Good afternoon and welcome. My name is Jeanne Mancini and I'm president of the March for Life Education and Defense Fund. I'm excited to be here with you this afternoon on this Facebook Live, and we so very much appreciate your support of the March for Life, and we'd love to know where you're watching from this afternoon, so let us know. Today I'm here with Tom McClusky, our Vice President of Government Affairs at the March for Life and President of March for Life Action, which is of course the advocacy arm of March for Life. Tom, can you share with our viewers just a little bit about the role of March for Life Action?
Sure. Just like the March for Life, as the March for Life tries to change the culture and work with groups and bring the pro-life movement together to conquer the scourge of abortion, March for Life Action tries to do that legislatively and easing the road for pro-life legislation and to help create a society where abortion is no longer thought necessary.
Right, that's great. That's great. Yeah, and even unthinkable. I mean, in some ways, and sometimes we describe the work of March for Life Action as trying to take the collective voice of the marchers to Capitol Hill every single day. And so Tom is the mouthpiece of that, and we're so very, very blessed.
I should have asked you to answer, because that was much more better and succinct.
No way. So anyways, thank you. So, well, what we really want to talk about this afternoon and what we want to help get you educated on is what's happening in our nation's capital, where we are right now. Our office is not too far from the White House and in the hub of all of the activity in terms of public policy. And there is a lot happening right now, in particular with regard to the healthcare bill. And so especially this week, we want to update you on our pro-life concerns with regard to the healthcare legislation that's sitting in the Senate right now. And there have been lots of breaking news stories about this in the past days. And so we're going to ask now that Tom can give us an update on the status of things.
That's really a big question. Trying to track the healthcare legislation from the very beginning has kind of been like trying to herd cats in a room full of rocking chairs. You never quite know what's going to pop up and whose claws are going to get you first. However, currently, the House passed legislation, and while March for Life or March for Life Action didn't take an overall view of the legislation that the House passed, one thing that was great about it was that it was pro-life from beginning to end. It made sure that no taxpayer subsidies went to pay for abortions, and it also defunded the abortion. Well, it directed money away from abortion providers, including abortion giant Planned Parenthood, and directs it instead into community health centers, which have a much longer pro-life history because they actually help take care of the community, not try to decimate it. Currently in the Senate, the bill is going through what is called the Byrd process, which I don't need to go into detail here. However, it's very likely that some of those pro-life protections will not go through this process. And so what we're doing is trying to work with the Senate, or good people in the Senate are trying to make sure that they can find a way that this legislation is pro-life from beginning to end, and to find 51 votes to pass it.
Mm-hmm. Mm-hmm. Great. And let me just say, if you're just joining us, I'm Jeanne Mancini. This is Tom McClusky. We're with the March for Life. We're so happy to have you here with us this afternoon. We're discussing the health care bill that currently sits in the Senate, and Tom was just mentioning the Byrd rule and our concerns that it's possible that pieces of the legislation that are pro-life protections will get won't pass through the Byrd rule, or won't sort of make it through. So anyway, so back to all of this. Why is it important, Tom, that there are pro-life protections in healthcare?
Because we've seen what happens when there isn't. When the healthcare bill that became known as Obamacare passed back in 2010, pro-life groups as well as pro-life politicians pointed, like everybody from Dan Lipinski to Chris Smith to Paul Ryan when he wasn't quite speaker yet, pointed out that this was not pro-life. It was going to subsidize abortions, and it turned out that we underestimated the damage it could do. Hundreds of thousands, well, millions of dollars have been sent to subsidize pro-abortion organizations through our through refundable tax credits, and through say government-sponsored health care plans. Like currently, right now, if you work on the Hill, or if you're a member of Congress, you can have taxpayers paying for your abortion. And on top of that, there are lawsuits it gave power to the Health and Human Services Department that allowed them to try to force organizations from the March for Life to Sisters of the Poor to pay for contraception, including contraception that could be seen as abortifacient.
Mm-hmm. That's right. That's right. The famous HHS mandate that we were so lucky that we won our lawsuit, the March for Life, and although we currently, there's a stay on our situation right now because the government had planned to appeal it. So we'll see. Of course, with the March for Life, we were opposed to certain drugs and devices, as you were saying, that were destructive of life, because in our very founding documents, it states that we begin to defend and protect life from conception. So even a baby that's really, really early in development and hasn't quite implanted is a baby that we want to protect. And some of those drugs and devices that groups like the March for Life were forced to cover could prevent implantation, and some even worked post-implantation. So yes, this was one of the many egregious aspects of the Affordable Care Act, popularly known as Obamacare. So and we know that it's great news with this current bill that Planned Parenthood, our nation's largest abortion provider, could be defunded. And actually, really the way this goes is it's not so much that Planned Parenthood would be defunded as they would be ineligible for Medicaid reimbursement. So really it's better to say it that way, because it's not that Planned Parenthood is losing any funding that they have per se. It's more that women would get their care from organizations that offer a wide variety of services and that outnumber Planned Parenthoods by 17-1. These are community health centers, and the health regulations are much stricter on community health centers than they are in abortion clinics. So to me, it's just a win-win situation for women's health.
And one of the biggest talking points, I think, came from the president as well as from his daughter, Ivanka Trump, who's in the administration, when they said, if you just stop doing abortions, we would lay off, and they refused to.
That's right. That's right. It's really heartbreaking, and it's a lot of people don't know that Planned Parenthood does abortions, as much as many of us in the pro-life movement know that very well. But in their latest annual report, it just came out about a month ago, it was noted that Planned Parenthood performed 328,348 abortions, and that was an increase of over 4,000 more from the prior year. So interestingly, the national number of abortions is on the decline, thankfully, but Planned Parenthood is increasing their number of abortions, so they're increasing their market share, essentially. So we are hoping very much that those parts of the healthcare bill will remain in. Another point to make with regard to the directing Planned Parenthood funding to other good healthcare organizations is simply the fetal parts trafficking scandal that they've been involved in. So I was shocked to read in Planned Parenthood's annual report that they said that the videos from the Center for Medical Progress had been widely discredited and heavily edited, when 2 forensic reports have shown that that's absolutely not the case, that they weren't edited or discredited, that they're absolutely honest. And
Planned Parenthood lied?
It's really, we should have as a starting point just telling the truth. I really think in these dialogues, and we can agree to disagree on certain things, but just being honest about some of these things should be true. So of course, the House looked into that investigation with the Center for Medical Progress and made referrals to the Department of Justice. In fact, as many as 11 referrals for criminal and regulatory problems, and the Senate as well made 7 referrals to the DOJ. So the March for Life has asked the Department of Justice to take this matter up and to look into it. It's so that justice is served. So that justice is served for the people involved. So,
to go back a little bit for more positive news on the Senate side with the status update, because we are worried about the text, and we are worried. We want to make sure, because it's not that these senators aren't pro-life. However, it will be very hard legislatively for them, perhaps because of the technical problems when it comes to writing legislation in the Senate, that it will be pro-life. However, there's some positive development. Last week, over 82 pro-life groups sent a letter to the Senate saying that if it did not redirect this money to community health centers, as well as make sure that Hyde-like pro-life protections are within the legislation, we would oppose. And just this week, Doug Lamborn, a congressman from Colorado, sent a letter signed by 70 of his colleagues saying the exact same thing, that they would oppose. So the Senate needs to get this right, and there are a lot of good people working on it. Text, we don't expect a CBO report, for legislation to pass in the Senate under these rules. What they need is a report from the Congressional Financing Office, basically how much will this cost, how it will affect the budget. So that won't come until Monday of next week. We expect the text as early as Thursday. A lot of members haven't seen the bill. Democrats are complaining right now. It's hypocrisy they're complaining, considering Obamacare was passed very much behind closed doors, as well as with they did not even welcome Republican input, even though there were some liberal Republicans who wanted to. Unfortunately, Republicans are kind of doing the same thing right now. So Democrats' claim has some merit about this being behind closed doors. However, we do expect to see text, and members do as well, as early as Thursday or Friday. And I would implore people to follow us on Twitter, follow us on Facebook, and other pro-life organizations too, like Family Research Council, SBA List, National Right to Life, Americans United for Life. These are all groups that will make sure that will be able to tell you right away after we read the text if this bill is something to support, or is it something we need to oppose.
It's critical that your senators hear from you about the importance of this bill and these pro-life protections. You can go to marchforlifeaction.org to send a message, or you can text March 4, the number 4, life, all one word, March 4 life, to 99000 to be able to contact your senators about this. We hope that this has been a helpful update for you. Thank you so much for joining us this afternoon, and on behalf of the March for Life, Tom and I, we'd like to thank you and say have a great afternoon.